Cystic fibrosis is a genetic disease that currently affects 30,000 patients living in the United States. Although millions of dollars are raised for research each year, there is currently no known cure. But a recent and unexpected discovery may have paved the way for that to change. To most people, William Buck is a typical 23-year-old boy. He studies business at Cal State Fullerton, has a part-time job, and loves surfing. But unlike most boys his age, William is living with a chronic, life-threatening disease.
So I started developing a cough when I was around 15 years old, and it wouldn't go away no matter what medicine I was on or time had passed. So I got referred to an allergist because they thought I just had asthma. And after being with the allergist for a while, he concluded I should go to a lung therapist because he thought it was more than asthma. They called me that night and told me that I had cystic fibrosis.
Cystic fibrosis, also known as CF, is an inherited disease that affects the respiratory and digestive systems, as well as the sweat glands and reproductive system.
Cystic fibrosis is a very complex disease. It's a genetic disease that kids are born with, and there's about 2,000 different copies of the gene. So every child with CF, or now young adult, is not the same.
It causes people with CF to get certain kinds of infections in their lungs, and over time, more and more damage to the lungs. It also affects the digestive system so that they have difficulty absorbing food.
Today, 1 in every 20 Americans is a carrier of the CF gene, but is not affected by the disease.
In order to have cystic fibrosis, you have to have 2 copies of the CF gene. So basically, mom has a copy of the gene and dad has a copy, but they don't have cystic fibrosis, they're carriers. And when they get together and have a child, it's a 25% chance that child will have CF. So if the child has CF, that means that they have 2 copies of the CF gene.
On average, people with CF today have a lifespan of about 40 years, and there is currently no known cure.
When I started out, it was very unusual to have an adult with cystic fibrosis.
William is one of 30,000 Americans living with CF today and one of 70,000 patients worldwide. Although 70% of CF patients are diagnosed by the age of 2, William did not find out until he was 15 years old.
I didn't know what cystic fibrosis was or what it entailed. I did some research on my own. I found some scary things. So I was kind of mad. I was mad, and I was scared.
In addition to a short life expectancy, CF patients are forced to cope with regular doctor and hospital visits, as well as daily medication and breathing treatments. This can often interfere with the patient's school, work, and social life, discouraging them from pursuing educational and career goals.
So I thought I'd have a shorter life, and that if I wanted to do anything, I should just get it done now. There's no time for college. Didn't think about having a family or anything like that.
Common symptoms of CF include thick, sticky mucus that accumulates in the patient's intestines and lungs, malnutrition, poor growth, frequent respiratory infections, difficulty breathing, and, over time, permanent lung damage.
People with CF need to eat about 50% more food than the rest of us because a lot of it just goes right through.
Because CF is caused by a mutation in the patient's genetic makeup, research for finding a cure has not been easy.
People have been trying for a long time to change the genetic makeup, and that's been unsuccessful.
Where it gets difficult is as we start, there's our most common gene, which is the delta 508, and there's about 90% of our population has at least 1 copy of that gene. So and that's where a lot of our research has gone. So when we develop a drug for that population, that will take care of 90%, but there's still that 10%.
But it seems that every cloud has a silver lining. In 2006, a group of Australian researchers noticed that something unexpected seemed to be treating the symptoms of those living with CF.
They noticed that they had patients who did quite well, who were surfing, and wondered whether the salt from the salt water from surfing would have an effect.
And there it was. The solution they had been looking for was that simple: salt water. Not only did this discovery help researchers understand the benefits of surfing itself, it also led to new developments in treatments for CF patients.
You breathe in hypertonic saline, which is basically just salt water, and that actually helps clear out the mucus that is in my lungs. And they actually derived that medical treatment from surfing.
We're used to drug company studies that are funded to the order of tens of millions of dollars. To their credit, without drug company backing, they did a similar quality of study.
This discovery was a critical step for treating CF. Today, there are dozens of organizations committed to raising money for CF research, the front runner of them being the Cystic Fibrosis Foundation.
Next year, our research budget is going to be actually $150 million that we're investing in research. We just push as hard as we can to find that cure.
Many of these organizations find ways to incorporate surfing into their activities with CF patients to enable them to stay active and improve their lung function.
The goal is to raise awareness for cystic fibrosis and to give the kids a natural saline treatment with the best surfers in the world.
We're pro surfers, and we get paired up with kids with cystic fibrosis and take them surfing to better their lifestyle.
Their treatment's in the hospital is saline, hypotonic saline, which is in the ocean. We want to get them stoked on surfing, so it's a natural treatment. At the same time, they're getting exercise and having fun.
To most people, a life expectancy of 40 years may seem short, but that is a big step for people living with CF.
Since the 1970s, when I started out, until now, it's gone from the late teens to the late 30s for the average patient with CF.
And researchers seem optimistic of a cure being in the near future.
I think when you hear our CEO talk, Bob Bell, who's been with the foundation for over 30 years, they feel that they will, have drugs like this for our patients within his lifetime, and he's kind of an older guy.
We've got a ways to go, but it's really encouraging from my standpoint.
Although William knows the health benefits that come with surfing, they aren't the only reason that he is passionate about it.
You work so hard to learn that skill set to paddle out, and then once you catch that wave, it's so worth it, and it's just a feeling you can't really describe to people.
William is hopeful that a cure will be found soon, but since he can't control the waves, he'll just have to keep surfing them.
There's really no point in worrying about this. This is just something that was given to me, and I need to live my life.
If you would like to find out more about how you can get involved in the search for a cure, you can visit www.cff.org. I'm Krysta Fauria, and thanks for watching.